Hi, everybody. Welcome to the today's webinar. How are you, Mehdi? You must unmute yourself.
Zileli. How are you?
Hi, welcome. How are you?
Fine, thank you very much. Thank you.
Good to see you. I
Thank
wish
you.
you are in fresh after a great meeting.
Yes. Yes, thank you. Thank you very much. And tomorrow
Mustafa,
I will be in Saudi Arabia, in Riyadh, for another meeting.
Mustafa, welcome. How are you? We can't hear you. There is something wrong with your connection, or microphone is not working, probably. I don't know what is it. Your microphone may not be working, Mustafa. No? Ömer, welcome.
Oh, thank you.
How are you?
Thank you, Dr. Zileli. Thank you very much. Everything is fine. Are you okay too?
Yeah, we are all fine.
Okay.
I think Francisco did not connect yet, but we are waiting. Okay, this is actually it's 5 p.m. in Turkey. This is our regular webinars on update of spine surgery. We know very well that we have diagnostic problems and we don't have a good correlation with the MR images or films and the source of the pain. This webinar contains that subject, and we will try to discuss it in different point of views. Mehdi Darmul will be the moderator. Yes, Mehdi,
I
you
can
can continue.
moderate. Thank you
Yeah.
very much, Prof. Zileli. Donc, today, good afternoon, everybody. Today, we will do this sample update of spine surgery with the topic diagnostic and the problem of back and leg pain. And we have for this webinar four eminent speaker, Professor Mehmet Zileli, well known, donc chairman of WFNS Education and Training Committee. Dr. Francesco Costa, my dear friend Francesco Costa, chief of spine unit in Italy, in Milan. We have also Dr. Mustafa Kurklu from Turkey, orthopedic surgeon, eminent orthopedic surgeon in Istanbul, and the fourth speaker, Dr. Mustafa Agoglu, chiropractor in and president of Turkish Chiropractic Association. Thank you for accepting our invitation and participating in this webinar. And now I think we start with Professor Zileli.
Yes, I will share my screen, and this is, yeah. Do you see my screen now?
No, no.
Not yet? Oh, sorry. Okay, sorry. That I must. What about now?
Yes, yes.
Okay. I will present a very simple case. This is a 62 years old female. She has had a low back pain for 30 years and right leg pain for 6 months. This is her films, the MR images. As you can see, there is an L5S1 isthmic type of spondylolisthesis and some narrowing in the foramen, and the disc height has decreased
It's
also.
not working, Prof. Zileli. The slide
You-
not
you-
running.
You don't see my slides?
No, no.
Sorry, I don't know the reason. What about now?
Yes. Yes.
Do you see
Okay.
my
Yes,
slide?
the first one, yes.
Yeah,
Okay.
okay.
Now you see.
These are the films of that 62 years old female with low back pain for many years and right leg pain for 6 months. We can just discuss what to do for this lady. I can ask participants or other speakers how to behave in a case like this. Ömer, can you make a comment on that?
Yes, she has a low back pain for 30 years and a long period, and she has a radiculopathy, leg pain for only 6 months. It means that there is another clinical situation around here. In MRI section and sagittal plan, we can see L5S1 degenerative type spondylolisthesis. And I don't think it is a acute lesion. It's very chronic lesion because there is a dysplastic changes at the top of S1 vertebra. That's why I wonder the other sections of the MRI scan, and physical examination is very important. What is the straight leg raising test? What is the result of lower extremity neurologic examination results? And I wonder to make hip flexion extension tests and other hip examination tests. Do you know anything about the examination results?
Yeah. Actually, there is no neurologic deficits. Straight leg raising test is negative.
Negative. What about the hip and sacroiliac joint examination results?
Yeah, sacroiliac joint examination was painful.
Painful. Okay.
Hip flexion and extension was all right.
Okay. In this type of patients, we have to visualize the sacroiliac joint also. It's direct X-ray, CT scan, or MRI.
Okay.
I'm
I
not
can
going to
ask.
talk about the treatment now because we didn't talk yet. After that, we can
Right.
talk about our opinions.
Yeah, right. Thank you. Are there any other participants to comment on the films and what type of a treatment can be applied for this lady? No. Actually, I will shortly present the case till the end. Actually, the sacroiliac joint test was positive. So because of that, we did a injection, a test injection first to the sacroiliac joint. And she got good benefit from test injection. Because of that, we applied a radio frequency lesion of the sacroiliac joint. And her pain completely relieved by RF lesion of the sacroiliac joint. So although many people can think that because of a significant listhesis, the patient should be operated, and probably a short segment fixation must be applied. But the source of the pain was not that ischemic listhesis or that degenerative listhesis, ischemic listhesis, what you say, it doesn't matter. And we did just one injection, and we could manage that patient without any surgery. This is the message of my case. A wrong diagnosis can happen if you just look at the films and do not examine the patient properly. We can have too many mistakes. Thank you for listening to me, and I think we can switch to other speakers.
Thank you,
I will
Professor Zileli.
stop sharing.